Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
Okay, so everyone who's there in the class, welcome everyone, and we are going to have a discussion of preterm labor and prom today in this class, and this is for your upcoming practicals. Again, congratulations to all my soldiers who've done so well in their exams, the theory exam. The results have been really great, and I again give a warm congratulations to everyone, a big hug from everyone to you, and at the same time start preparing for your practicals, which you actually are. I have already got students for the upcoming week, and they have started preparing their PPTs, their lectures, their case, and also rehearsing with me before the final day, which is a very, very organized system. You are immediately, the moment you know that you are presenting a case, you are put into a group called rehearsal group, and you get to rehearse with me. You show me your slides, I ask you questions, you get rehearsal, you get a recorded video, what kind of questions can come from this kind of discussion, and you're well prepared in front of my group. And you must have seen up till now so many cases we have discussed by now, and you see the confidence level of the students who are presenting the case, which is my main aim of taking these classes, guys. So everybody who's watching these lectures, who are there in my classes, who are taking time out from their schedule to listen to my classes, knows this, that it is actually going a long way in building confidence for the final day. And for that, this is the reason why I'm here, to prepare you for your final day. The more you're prepared, the easier it will be for you. Correct? All right. So over to you, Shreya. Let's start our case now.
Yes, ma'am. Good afternoon, ma'am. Good afternoon, everyone. I'll start my case. Name of my patient is Mrs. X, 29 years female, resident of New Tippasandra, Bangalore, occupation employee in DRDO, educated till MSc Electronics, wife of Mr. X, doing private job, belonging to upper middle class by modified Kupuswamy classification. Date of admission was on 1st of August 2024. Last menstrual period was on 14th of December 2023. Expected date of delivery by LMP was 20th of September 2024 by regular menstrual cycle. Period of gestation is 33 weeks. Obstetric score, she is primigravida.
Okay.
Chief complaint, primigravida with 8 months of amenorrhea, perceiving active fetal movements, complain of pain abdomen since morning 4:30 a.m. No complaint of PV leaking or PV bleeding. Then
So
history of pregnancy.
Yeah, she's having just pain abdomen since 4:30 a.m. All right. What was
Yes,
the time
ma'am.
she visited you?
Ma'am, around 9:30, she came to the casualty.
Okay, and she came to you at 9:30. That means almost 5 hours later.
Yes, ma'am.
And probably this pain was, less to start with. Then it kept on increasing. Was it like that? What this was the history? Let's hear
Yes,
it from
ma'am.
your history of presenting illness. Let's hear this. Yeah.
History of presenting illness. Patient complained of lower abdominal pain since morning 4:30 a.m. That is on 1st of August 2024. This lower abdominal pain radiating to her back that was intermittent in nature. She told ma'am it is mild in intensity with no aggravating and relieving factors.
Okay.
No complaint of bleeding PV or leaking PV. No bowel or bladder complaint. No complaint of foul smelling discharge per vagina.
Okay. So this is your only presenting history. This thing, Shreya. So now she's having complaint of pain abdomen when I say from 4:30 a.m. Our first DD does not always go in the diagnosis of labor pains alone. Obviously, she's pregnant, so this is the first thing that comes into our mind, but that's not the only thing, right? So what are we thinking? What all factors are coming into your mind right now because of which you asked for this negative history? Tell me that. What DDs are coming into your mind?
Ma'am, like if she's having urinary tract infection.
First, you can say, the Braxton contractions.
Yes,
Or
ma'am. False labor pain.
Let's start with the most common one. It could be a false labor pain, could be a true labor pain.
False.
Then
Then it can be any gastrointestinal pain also associated with some bowel habits.
Yes, very true. Because here she said intermittent in nature, mild in intensity, no aggravating or relieving factors. But she said no bowel and bladder complaint. But how many times it happens that first it starts with pain abdomen, then you have, maybe after 4-5 hours loose stools or vomiting or something else. So eventually in 4-5 hours, if you ask anybody, even with the gastrointestinal pain, she'll say no bowel and bladder complaints, right? She came to
Yes,
you
ma'am.
because she was pregnant, all right? Had she been non-pregnant, probably she would have just waited it out, isn't it? Maybe she would have come to you after 2 days. Since she's pregnant, she's come to you in 5 hours thinking that what if it's a labor pain? She's confusing it. But your DD will always require, could be a false labor, could be a true labor, could be gastrointestinal discomfort. What else?
Ma'am, it might be urinary tract infection also.
Yes. Colicky pain can be, a sudden dysuria or a sudden colicky pain due to ureteric colic also sometimes, but that's very specific. Where does a ureteric colic pain feel maximum? Guys, you answer now. My students who are sitting in the audience, they will answer. Where do you feel the ureteric colic pain the maximum? It doesn't, or to a hint for you, it is not in the abdomen or even anterior abdomen. But yes, very specific categoric, it's the loin or the flank pain. That's where you get the ureteric colic. Very good, excellent, excellent. Everybody is awake. All right. Yes, Shreya. So this is one of our DDs. One is UTI, one is gastrointestinal discomfort. Anything else?
Threatened preterm labor, ma'am, might be.
Yeah. I mean, obviously, threatened preterm. Yes. What else? Anything else that's coming in your mind? Anybody else wants to give any DD? You're also most welcome. There could be things that we are overlooking. Anything that you feel? See, when I say gastrointestinal discomfort, it could be gastroenteritis, it could be appendicitis, it could be just a gastric colicky pain. All these things are included. Okay, I don't have to specify it's cholecystitis or appendicitis or diverticulitis. I don't specify. This is gastrointestinal complaints, no gastrointestinal or gastrointestinal pain for that matter. All right. So this is why we asked. Okay, now when you are asking about the pain per se to a patient, that gives you a lot of information about what kind of pain is it. So when she says there was no aggravating or relieving factor, what exactly were you asking? What could be a probable aggravating or relieving factor for her?
Ma'am, I asked her any posture, food, or if the pain is increasing on walking or sitting, or it is associated with food.
Okay, very good. That's the basic that you will ask, isn't it? Any patient, especially the pregnant patient, whether it is getting aggravated on standing, whether it is getting relieved on sitting, or it's getting relieved on lying down, or she has more discomfort when she is lying down right, left, or bending, walking, correct? Second thing, relieving or it gets aggravated with intake of food, appetite loss, vomiting, nausea, anything which has suddenly increased in the past these few hours that she's feeling. Any history of fever, okay, that could also be giving us a hint at what we are dealing with here. She came to us with pain and we are just taking the history. We have not touched the patient. Okay, so this is what I told you in the last class. I'll repeat the same thing in this class. Always be a little away from your case. Don't be just focusing on preterm labor and prom alone because it's a class on that. Just walk a step back from your patient and see. We're missing out a couple of very important DDs, and this is what your examiner, they hold you, and you're suddenly taken aback in the very first, minute of your Viva that, oh my God, they are asking about gastrointestinal symptoms, and I haven't even thought about it. Why didn't I mention them? What are they hinting towards? Okay, and the Viva is going slowly and steadily, seeing your discomfort. Slowly, the Viva is going to actually these points of gastrointestinal discomfort, like maybe they are talking about appendicitis, features of appendicitis in pregnancy. How is it bad in the appendicity, this pregnancy? Which trimester would you like to do the operation on? Suppose there is an acute flare in the first trimester, so can you do that or not? So these questions will just throw you out of your game, and that is what I do want. It's better you're prepared before, and that is the idea of taking these classes. All right, Shreya. So we have talked about the kind of pain that she was having. Now it was mild in intensity. All right. Did you
Yes,
ask
ma'am.
where does it start? Where does it go?Here does it radiate? Anything that she said like
Ma'am,
that?
yes, ma'am. She told it starts from lower abdomen and it is radiating to her back.
Yeah. So that's very similar to our usual history that we have taken from so many patients who come with labor pain. All right. So in our mind, we're slowly making the DD of her going to either false or true labor. Obviously, when it says true labor, it is threatened or preterm labor. Radiating to her back, starting from lower abdomen, it is intermittent in nature. Okay, and it is mild. Every detail has been spoken about. All right. Anything specific in your first semester history for this patient?
No, ma'am.
Nothing. She was on Hyronorm tablet and
Just she was on thyroid.
And she was your booked case, right?
Yes, ma'am.
Okay. Second trimester, anything specific?
No, ma'am.
All right, guys, now you tell me anything specific with history which I would specifically want to know in this patient in a second or third trimester. In our patient, I would want to know something. In second or third trimester, she is around, how many weeks did we say she is?
33 weeks, ma'am.
33 weeks, okay. So she's almost 8 months amenorrhea, we said that. Okay, Nikita says no history of PV bleeding. You want to know whether she had any episode of PV bleeding in second trimester, third trimester. Okay. Okay, how does it relate to threatened preterm, Nikita? Tell me that also. Okay, history of APH. Even Usi has also said the same thing. Very good, very good. APH, definitely it can lead to preterm, but more so it will lead to APH itself, isn't it? The more alarming symptom is APH, right? What I was looking forward to is any local source of infection. It could be a recurrent UTI, it could be a recurrent vaginal infections. So I'm looking forward to any local source of infection, which we start catching from second trimester onwards. See, this is how we build the case. Okay, this is why my theory, obviously, this important questions, relevant important questions of history are important. So it's very true that we want to see if there was any, she was harboring any local source of infection. Maybe a dental infection. She's having a toothache since long. That could be a source of infection. There could be a recurrent, UTI. That's a source of infection. You know that she will go on threatened preterm someday. She started having a lot of vaginal infections. Even in first, second trimester, there were a lot of vaginal infections. We were giving medicine to medicine, and it was used to come back again. Source of preterm, the reason for a preterm labor. Absolutely right. Okay, so Shreya, we did not have such an episode in our patient, right?
Yes, ma'am.
All right. Anything specific in this history? Otherwise, everything is okay, correct?
Yes, ma'am.
And there is no history of leaking.
Yes, ma'am. No history of leaking, no history of bleeding.
Bleeding. All right. Fetal movements perceived fine. Okay. She is a primary.
Yeah, yes, ma'am. She's primary gravida, married since 2.5 years, consanguineous marriage.
Oh, it's a consanguineous marriage. Okay. Obviously, it's not very relevant here, but yes, if it's a consanguineous marriage, I hope she had done all the important tests in her first and second
Yes, ma'am.
trimester. The
Yes,
combined
ma'am.
test.
Serology was done.
Serology. What do you do for aneuploidy screening in your institute?
Ma'am, that NT scan, double marker, and anomaly scan, all was normal, ma'am.
So that is integrated scanning, in which we see the maternal age nuchal NT scan, and we see the biochemical markers, right? So the integrated
Yes, ma'am.
scan came out negative, and why I'm asking this, because it was a consanguineous marriage. So NT's
Consanguineous
basis screening is a must. This is just besides the point, because you said consanguineous marriage is a different, history. So I'm unnecessarily, asking some irrelevant questions to you just because the history was mentioning something which is offbeat. This is what happens in your Viva. The moment you say something offbeat, suddenly 2-3 questions are sprung upon you from there. And if you fumble there, unnecessarily you were not prepared. You were not prepared for those questions to come. You fumble there, and you are unnecessarily exposing an area of yours which you shouldn't have had. So I'm saying for you guys, I understand it's a consanguineous marriage, but you can either skip this thing in your exams, or you can just tell this once the examiner asks you. Okay, unless and until it's a very relevant history, you can skip it unless it's a very important point which has to be mentioned, that no, it was not like this, it was like this, which I'll tell you as you move forward. Okay, so obstetric history, she was a primary gravida. Okay, what was her age, Shreya? Age of her patient?
Ma'am, 29 years.
So guys, can you quickly tell me preterm labor as such, in general, when is it more common? In which strata of patients is it more common? Are there some risk factors for preterm labor? Come on, guys, quickly, answer quickly, because everything is going in recording. So I would want you to, okay. So young girls, young pregnancies, usually teenage girls, the pregnancies agreed, they usually end up having preterm labor. Socioeconomic status is very important, okay? Very elderly also can enter into preterm labor. Very young can also enter into preterm, both extremes of age. That is one. Occupational history, very important. Stressful job, very important. Long hours of standing, very important.